tell us a little bit about your route kind of into the physio industry, how you got into it.
Well, firstly, I think I didn't really plan so much on doing physio straight away, but I knew I wanted to help people get better post injuries and stuff, because I've always been into sports. Then I kind of started reading up about it, and I got really involved and did some shadowing at the hospitals and stuff. And actually, I went into physio, like studying, thinking I was going to come out as a paediatric physiotherapist. Mm-hmm. How different could I have been? Yeah, and all the way through my 4-year course, up until my last placement, was I determined to be a paediatric physio. So it all changed when I went to Headley Court, which was a military rehab centre, which is now shut down actually. But yeah, I went there, and then that changed my kind of whole outlook on what I wanted to do physio-wise. But yeah, kind of total turn it upside down and everything. Yeah.
And then when you left there, so when you were qualified, what kind of route did you take then? Did you go straight into work? Did you have a little bit of a gap? How did you play it?
I had a gap actually. My mind was a bit, after dissertation, you are like dead. There's not much left of brain power. So I think I graduated in June 2013, and then I didn't get a job till November 18. But I really needed that time and enjoyed it. I mean, you are interview prepping, and then I did about 5 interviews. I came second in all 5, and then eventually all of them, after like a few days, they all offered it to me, and then I had 5 offers. It was crazy. But I chose my physio career. I haven't gone the normal route. A normal physio would go 2 years rotational as a band 5 after graduating throughout the hospital, getting experience in different areas. Then you'd do the same thing for another 2 years at like a band 6 level, and then you'd kind of specialise in your area. I went straight into MSK, which is kind of outpatients or sport physiotherapy in a way, straight away, for like an insurance company, basically dealing with medical legal things like road traffic accidents, whiplash, all of that. So I kind of have a different pathway, which isn't the normal. Yeah. I did that for about 2 years, a bit cheekily got all the courses out of them that I could, and then left. And then I went off to Canada, which was, that really, I think, developed me to being a physio. I think I was a bit of a physio that just did it, went through the motions of being a physio, but not actually thinking for myself. Whereas Canada, it really challenged me to think and be like, question the norms. And be like, well, why do we do this? Couldn't there be a better way? And actually, it was really cool being in like this challenging, high elite environment when you are the worst person in the room.
Who did you work with in Canada, and how long were you there for?
I was there for just under 2 years, and we did a lot with the ice hockey players, professional ice hockey players, but also Canada snowcross team. So a lot of quick, intense sessions over 2 weeks that they're back, and then they're off for competition. So you really have to be kind of fine tuning and on point with what niggles they have. Is it going to be detrimental? Because you can't really control snowcross, because if they're going to wipe out and get knocked out by someone else, you can't. But you've got to try and minimise the risk. Yeah. And then one of us would go to the competition. That was actually, unfortunately, never me, because I was very junior. Because they could go to like South Africa and Russia and stuff like that, but I never got to go. Wow. But no, that I enjoyed that. But actually, again, the elite sport is really fun. But again, to me, it's not as satisfying as if, I think you need a mixture, in my point of view. It's not as satisfying as treating somebody that would never normally come to physio, and you make a big difference in their life. Mm. That, to me, is more important than the fine-tuning of like an elite athlete, because they get it so regularly, 4 times, 5 times a week, then actually to them it's okay. It's good for me because I can at least really work on stuff that I wouldn't do in normal sessions, because I have time. I have time to work on one muscle and really, really work that muscle and fine-tune each section, whereas you don't get that in a normal physio kind of environment. You need to kind of fix the problem and hope.
Yeah. Is that something you now obviously kind of work more with people that have just either picked up niggles, either kind of like chronic injuries or impact injuries? Is it more, this will be the route we'll veer down in a second, kind of more what would you say, like amateur athletes or recreational athletes and kind of everyday people, if you like, that have picked up niggles? Is that more the people you work with now?
Yeah, I'd say that's definitely now. I do still have a few kind of elite people on my books, which kind of keeps them on my toes, which is quite nice actually. Like I said, like that mix up. But I would say the majority of it, 90% of my caseload is everyday people or people who've picked up injuries, especially with lockdown. People are having to really think about exercising for themselves outside the gym, trying things more outside. But when people get a passion for it, they get really into it. As we all do, and then they do it every day, and that's where a lot of the injuries come. And I'm sure you've seen that.
Yeah, yeah,
through your way as well.
Well, that's what I was going to go on to next. Actually, you find good segue. You find normally either end of the spectrum, like at the moment, especially with the pandemic and stuff, that people are either, or a mixture of both, either sat down more during the day, or they're running more, or they're kind of they've got more time for exercising or training. Is that something you've seen in your practice? Because obviously, you're an essential service, so you've been able to carry on. Is that something you've seen with people?
Yeah, I've seen that all or nothing approach is what you're kind of saying.
Yeah.
Definitely the nothing approach, and the fact that people are having to work at home more often. So at work, they go through workplace assessments, everything's set up to them. They don't hot desk because they're really trying to phase out the whole hot desk scenario. And so they're sitting around their makeshift home desk, which they're expected to do, let's say 8 hours, 10 hours a day. And, that's going to cause some kind of really poor postures that we adapt to kind of get things done. No one will sit properly, guaranteed. And they're not going to set it up properly until they start getting pain. So you can imagine how long they've sat in those positions on inappropriate chairs, desk heights, screen heights, because most people will be working from a laptop. Not many people these days have desktops at home. So again, so I've picked up quite a lot of sort of neck, upper thoracic pains, but also going into sort of shoulder tendinopathy type pains as well, purely because of the prolonged positions. No one should be in a prolonged position for that long.
Yeah.
Anyway, we always, there's the rule of 5-minute walkabout every hour. I highly doubt that that's happening at home.
Easier said than done.
Yeah, exactly. I mean, I don't do it as well, and I complain, and then I go, oh, maybe I should do that, and actually I do feel better. So it is generally very good. It just needs to be adhered to.
Yeah, and it's worth taking more of a proactive instead of reactive approach, so that you're kind of on top of it before these issues occur. But if you were people that are sat down more during the day, any kind of necessarily tips or exercises that they could do to alleviate any of the kind of hot spots? Oh,
for sure. I always advise them to come see me prior to it getting really bad. But that's not a plug for me. That is more I think you need to get your setup correct. You need to have everything at 90. Just think 90. So elbow at 90, wrist nice and flat on the desk, hips at 90, knees at 90, ankles at 90. Then the computer should be just below your horizon, as they say. Again, that means you might have to put your laptop up on books, which means then you have to raise your wrists height slightly. So it's going to be a lot of tweaking. But the main thing, I would get up every hour and do a 5-10 minute walk around. You could do some stretches, at least arch back a bit, get a bit of extension through the thoracic, because predominantly most of us are hunched over like I am right now, to type away. So I think that it's more the regular breaks and breaking up those positions that is the key one. And then if you can try maximising setting up at the start, that would be useful, I think.
Well, so that would be the desk workers. In terms of if you're kind of looking at the other end, although it can be a combination of the two, if people are sat down all day and then want to go out for a run, or they're running more than normal, we're seeing a lot of people now running more maybe than they were before, or they've started running if they didn't before. Is there any, again, similar to the desk work, is there any common trends that you see and any kind of tips that you offer people to help those hot spots from tightening up or picking up injuries? Yeah, well, firstly, you need to be strong to run. So remember that we had a lovely talk that we prepared that we never did. About being, strong to run. You need to be, and that's probably coming from your classes. So, all single leg stuff. But for running, everything's done in gradual
gradual stages, like if you're used to going to the gym 5 times a day, 5 times a week, and doing sort of weight training, and only at the end doing like 10 minutes of cardio, you're gonna have to really build up running slowly. You can't do like a normal runner would do 4 or 5 runs a week. You're gonna have to run, have a rest day, run, rest day, see how your legs feel, maybe to start with 2 a week. And again, start with a lower distance, something that doesn't irritate, because you need to get your sort of muscles, tendons and everything used to the impact load. And it responds good to gradual changes, but it gets very irritated with sudden change. It doesn't like it. So you're going to cause more injuries by being really enthusiastic than just being patient and sticking to a program. So my advice is first to do the gradual. Then I would do definitely some lateral sort of glute work, anything like that, because you'll be running outside. I don't think that many people have treadmills at home. So you're not going to have perfect even surfaces. So you will have that instability coming through your foot that you won't even notice. Even on road it does happen, more so on trails. So you should do any lateral glute work for like hip stability to kind of support. And then the other 2 muscle groups I would probably work on is your calves and your hamstrings, because most runners are quad dominant. They can function with that perfectly, and even the elite ones, I can test them and they are so weak in their hamstrings to quad ratio. And then their calves, they can only rep about 10 reps to failure, whereas we're looking for about 25 reps as a minimum. I'm looking for failure, 2 seconds up, 2 seconds down, a slight tap on the floor and then back up again, and single leg, that is not both at a time. So I would really work on the calves and the hamstrings to kind of even up the proportion personally, because all runners very quad dominant, very weak through the hips, but they will naturally be either hip strong or calf strong. So ankle to hip ratio is definite, but that doesn't matter as such, because it just changed where you strike as you're on your feet basically. But definite gradual, and make yourself stronger before you really start putting the mileage in.
Bro. So desk bound people, keep moving as much as possible and work on your seated, your desk position. And the runners, you'd look at kind of making sure that you're ready or you're strong enough to run. And even adding in a simple tip, I suppose, add in some calf raises, maybe on the day you're not running, just to make sure that they're strong enough to handle the running load. Pretty much. Excellent. Bro, thank you for chatting. Where's the best place to get in touch with you if people want to get in touch?
Probably email or phone. You can message me through any kind of social media networks. You can't book in online at the moment because I'm all over the place. That there's not a regular shift going on at the moment, so I've just left it off. If you want to message me, you can find me, like I say, email, phone, or social media.
Catalyst Kinetics. That's the one. Cool. So we'll see what feedback we get from this, and if we get any questions on certain topics, and we might look at doing some more and just kind of veering off on certain routes or certain topics. But thank you for chatting.
Perfect. That's all right. Thanks for having me.
Cheers, Lottie.